Hello, my name is Billy Williams. I want to thank you for taking the time to watch this presentation. If you're watching this, you are probably going to be turning 65 in the near future. You're trying to do some research and gather information to help you with the different choices that you're going to have to make in the near future. We are an independent agency that specializes in the Medicare market. This is all we do all day, every day, is work with people to help them to decide what are the decisions that they need to make, when to make those decisions, what type of additional products that you're going to need in addition to your Medicare in the future. Here are some of the things that we'll cover. We're going to cover the four parts of Medicare, which are Part A, Part B, Part C, and Part D. We're going to talk about the two main choices that you have when you do turn 65 or do start Part B of Medicare. We're going to talk a little bit about what Medicare only covers. Then we're going to look at a Medicare supplement plan, how to compare and how to choose a Medicare supplement. We're going to talk a little bit about Medicare Advantage, which are network plans, how to choose and compare a Medicare Advantage. We're also going to talk about Part D, which is prescription drug plans. And then the last thing on the list here is important dates that you're going to have to remember as far as when you are able to enroll in the different parts of Medicare. A little bit about myself. My name is Billy Williams. I live in Texas. My hometown is San Antonio. I have been a licensed independent agent now for over 10 years, and I specialize in the Medicare market. Below you will see a list of the current states that I am licensed in. We do work with folks all across the United States. Medicare, Medicare supplements, Medicare Advantage, Part D plans, in some situations are the same from state to state. In some situations they are different. But we are very experienced in helping people regardless of where they live. Here are a few things that I feel are important benefits that I offer. Because I am an independent agent, I'm not partial to any one company. So we will not try to steer you to any one specific insurance company. We do, of course, want to make sure that we place you with a company that has a good reputation in the marketplace, an insurance plan that we have dealt with for many years and have many customers, and we have a good track record. Another thing that we do, once you are a customer of our agency, we do want to talk to you on an annual basis to review your plan. We want to look at what your current premium is. We want to talk about any future rate increases. If at some point we feel like it's in your best interest to make a change, we will recommend a change in your coverage and help you make that change. Another important thing we like to explain to people is, as an independent agent, my services to you are always free. This means you never pay me anything. There's no money ever changes hands between you and I. The way we make our money is if we bring a new customer to the insurance company, you pay your monthly premiums, and we are paid a commission on that amount. Okay, let's start by looking at the four main parts of Medicare. Part A is called hospital insurance. Part B is called medical. On these two parts of Medicare, fairly straightforward. So if you receive medical care where you are officially admitted to the hospital or some other similar facility such as hospice care, a skilled nursing facility, a rehab center, then your medical costs will be paid under Part A. Part B, which is called medical, is therefore everything else. So if you need to go see your doctor, if you do any follow up, blood work, testing, any type of therapy, any type of outpatient services, emergency room, ambulance, home health care, all of these services will be paid under Part B of Medicare. Part C of Medicare is a special program that combines Part A and Part D as well as prescription coverage. Your Part C are either going to be an HMO or a PPO, and we're going to talk about Medicare Advantage plans in more detail later. Part D is your prescription coverage. Many individuals that we work with, choosing the correct Part D prescription plan is very important so that we can assist in finding a way for you to get the medicines that you need on a regular basis at the least expensive cost to you. Okay, this page shows a little bit more detail in the decisions that you're going to have to make when it comes to choosing your Medicare coverage. On the left side, we have what's referred to as Original Medicare, Part A and B, or Medicare Advantage. So the first thing that you're going to have to decide is if you do want to get a Medicare supplement plan. You're going to choose what company and what plan letter, and we will help you make that decision. If you have Part A and Part B of Medicare as your main coverage, and then you have a Medicare supplement plan as your secondary, then at that point you will also need to choose a separate standalone prescription drug plan. So you have Part A and Part B, you have a Medicare supplement, and you have a prescription plan. So that is option number one. Option number two would be to get a Medicare Advantage. The way a Medicare Advantage plan works is a little bit different than a Medicare and a Medicare supplement. The source of the money is the same, so it comes from Medicare. If you have Original Medicare and you go to your doctor, the doctor files a claim to Medicare and the money is paid to the doctor from Medicare. However, if you have a Medicare Advantage plan, it's a little bit different framework. So, for example, if you had a Medicare Advantage plan, and let's say you had the same scenario, you go to your doctor is not going to send a claim to Medicare. They're going to send a claim to the insurance company. So the way that works is an insurance company has a contract with Medicare that stipulates that Medicare will pay them a certain amount of money each month to provide medical care to you. Then the insurance company will find a group of doctors and hospitals and specialists that want to participate in a network. Those medical providers have a contract with the insurance company that stipulates in advance if the insurance company sends you to a specific provider, or if you choose a specific provider in the network, that provider has already agreed in advance exactly how much they're going to be paid by the insurance company for the specific services that they are providing to you. You will also have a contract, outline of coverage, that explains that you do have to go to doctors in the network and that you also have a series of cost sharing payments. Sometimes they're relatively small co-payments. Sometimes they're a little bit larger, and then on other occasions there are a percentage. So on a Part C, a Medicare Advantage, you do have to have Part A and Part B of Medicare. They will usually include your Part D coverage. Now, there's two different types of Medicare Advantages. One is an HMO, the other is a PPO. On an HMO, it's the most restrictive contract, which stipulates that your primary physician must have a contract with the organization. Every other doctor has to have a contract. You have to go through your primary doctor to get permission to see a specialist, to get a referral to see a specialist. PPO is not so strict. You have much more flexibility, and you have the ability to see more doctors in your area. Now, Medicare Part A and B and a Medicare supplement is going to offer you more flexibility because Medicare and a Medicare supplement, you can go to any medical provider in the country that accepts Medicare. If you have a Medicare Advantage plan, these are only area plans. They're only going to be good in the geographic area where you live. It's normally a list of counties around where you live currently. The reason some people will choose a Medicare Advantage plan is sometimes the monthly premium is less, but your possible maximum out of pocket is more. We'll explain all of this in more detail as we get an opportunity to speak with you. Okay, we're going to talk now on this particular page a little bit about what Medicare itself covers. We're going to start with Part A of Medicare. For most people, to get Part A of Medicare, you have to be 65. There are some exceptions to that. For most people, Part A of Medicare is going to be free. It's not going to cost you anything as long as you have worked 10 years or 40 quarters. Now, some individuals, if you do not have a work history, you are able to draw off of your current or past spouse's work history. Part A works at any hospital that accepts Medicare. The first thing to look at is your Part A deductible. For 2019, the Part A deductible is $1,364. What this means is if you had Medicare only and you do not have a Medicare supplement or a Medicare Advantage plan, if you're admitted to the hospital, you're going to pay $1,364. Now, this deductible could happen more than one time in a calendar year if you go to the hospital more than once and the two situations that caused you to be in the hospital have a gap of time of 60 days. So if you went to the hospital in January, you're going to pay $1,364. Let's say in June, you go back to the hospital, you're going to pay that $1,364 again. We don't want you to have to do that, so we will help you make some decisions that will take care of that deductible for you. Now, it's very rare that you would ever be in the hospital for more than 60 days, but it can happen. If you have Medicare only and you are in the hospital for more than 60 days, starting on day 61, you will have a daily copayment of $341, and that lasts until day 90. So if you're in the hospital for 90 days, including your Part A deductible and 30 days of $341 each day, a 90-day hospital stay would cost you $11,594. Next, we're going to talk about Part B of Medicare. Part B of Medicare covers you for any medical care you need that is not a stay in the hospital. Unlike Part A, Part B is not free. Most people are eligible for Part B at age 65. And currently, most people will pay $135.50 per month for Part B of Medicare. This amount could be different based on your income, but most people will pay the $135.50. You can use Part B of Medicare at any medical provider that accepts Medicare. The way Part B works is if you have Medicare only, there is an annual deductible of $185 for the year 2019. That means the first time that you receive medical care under Part B, you're going to pay the first $185. Once the Part B deductible is covered, Medicare is going to pay 80% of all of your Part B medical care, and then you will owe 20%. Now, 80% is a lot, and it's certainly very good coverage. But as you probably know, 20% of a large medical bill can add up as well. So we do not want you to be responsible for that 20%. We're going to offer you some additional coverage that will cover that for you. The other important thing at the very bottom, if you have Medicare only, there is no maximum out of pocket. What that means is that 20%, it doesn't ever stop. You don't have an $8,000 maximum out of pocket, or a $10,000 maximum out of pocket. That 20% can just keep going up. So again, you do not want to be responsible for an open-ended, unsure 20% copayment. And again, we're going to help you solve that problem. Now we're going to talk about Medicare supplement plans. Sometimes these are referred to as a Medigap policy. You must have Part A and Part B of Medicare to get a Medicare supplement. You will pay a monthly premium for a Medicare supplement policy in addition to your Medicare Part B premium. Your Medicare supplement does not pay for routine prescription drugs. The cost of a Medicare supplement plan will vary depending on a number of scenarios. Number one is where you live. The other is your age, your gender, if you qualify for a household discount, and so forth. Your premiums for a Medicare supplement in the future will depend on the claims that are experienced by everyone else that has that same plan in your area. As we mentioned before, one of the services that we do provide to our customers is we are going to price shop your Medicare supplement plan on an annual basis. You can get a Medicare supplement plan when you first turn 65 or when your Medicare Part B starts and you have a 6-month open enrollment period. During your 6-month open enrollment, you're allowed to choose any Medicare supplement plan with any company. There are no health questions. So it's a very simple process. We decide what plan letter is the best for you. We decide what company we recommend. We gather a few pieces of information from you. We send that information to the insurance company. They will process your application, issue your policy, mail you your policy and your ID cards. You can use a Medicare supplement plan anywhere that Medicare is accepted. There are a number of Medicare supplement plans to choose from. When we speak with you and we quote you some rates, most likely the only two plans that we're going to talk about are Plan G as in girl, Plan N as in Nancy. Okay, here's a chart that goes into a little bit more detail on the Medicare supplement plans and how they work. You can see we've highlighted in yellow the only 3 plans that we sell: Plan F, Plan G, and Plan N. If we were talking to you maybe 3, 4, 5 years ago, we might have actually recommended the Plan F. The Plan F is the best coverage in the sense that it pays for all the deductibles and all the co-payments. However, it has been decided that Plan F is going to be phased out of the marketplace next year, and therefore there's not a lot of competition for the Plan F, and therefore the premiums are higher than we think they should be. We have actually been recommending the Plan G to our customers for many years, and you can see in the column that says Part B deductible, that's really the only difference between the Plan F and the Plan G. Plan F does pay the Part B deductible for you. Plan G does not. However, they both do pay 100% for a stay in the hospital. So in many cases, the value of the Plan G is much better. The monthly premium is much less than the Plan F. The only difference is the Part B deductible. Now, we also will talk to you about the Plan N. The Plan N does also cover you 100% for stay in the hospital. It does also require you to pay your Part B deductible. The biggest difference in the Plan N, you can see it over to the right here, after your Part B deductible has been paid, if you have additional visits to a doctor and the doctor does send a claim to Medicare that includes a doctor office visit fee, you're going to pay 20% of that fee on a sliding scale, but a maximum of $20. It's like a copayment. So after your deductible has been paid, you're going to have a copayment for doctor visits. The other situation where you might have a small out-of-pocket expense is if you are treated at a hospital emergency room. You're going to pay 20% of that fee, up to $50, assuming that you're not admitted to the hospital. So the way a Medicare supplement works as far as future premiums, whenever you join a Medicare supplement plan with any company, you're added to a group of people. That group is determined by where you live, what company that you choose, what plan letter that you choose. The insurance company is required to maintain a minimum ratio, 80% premiums to claims. What that means is for every $100 that's paid to the insurance company by members of your group, the insurance company must pay back out at least $80 in claims. They are required to keep very detailed records for each group. They're going to report these numbers to your state insurance commissioner. If at some point the insurance company is paying more than 80%, they're going to request a rate increase. So you will get a small rate increase on your Medicare supplement plan approximately once each year. Now, the insurance company is required to let you know, and then we will know in advance as well when you're going to be getting a rate increase. If at some point in the future your rate increase takes you to a point where we feel you're paying too much, we're going to look at the competition, we're going to look at other companies, we're going to look at how your new rate compares to other companies, and if we need to, we can take some action. All Medicare supplement plans have the exact same benefits. So you might be looking at Medicare supplement plans by many different companies. If one insurance company's premium is higher, that does not mean that the benefits are better. You're going to see a very large range of pricing on the Medicare supplement policies, even at age 65. As an independent agent, as I've said multiple times, we are not going to steer you towards any one company. We're definitely not going to try to put you with the most expensive company. We might also not always put you with the very cheapest company for a number of reasons, but we will try to get you the best value and also at the same time make sure that we put you with a company that has a good reputation, that we have a good track record with, and that we feel very confident in recommending to you. This chart again is talking about Part C, which is Medicare Advantage. And what this is trying to represent is that Medicare Advantage plans are not standardized. Medicare Advantage plans all have a similar framework in the sense that they have a monthly payment, they have a network, they help with prescription drugs, they have a set of co-payments, but they are all different. There are some plans that actually, in some areas, actually have a zero premium. Some are more expensive. So it's a little bit more difficult to compare Medicare Advantage. Now, Medicare supplement plans are the same across the United States. Medicare Advantage are specific to geographic areas. So if you want to consider a Medicare Advantage, we will go to the Medicare website. We will look at your zip code and your county. We will see what companies are offering Medicare Advantage plans in your area. If we see one that might work out for you, we will then get a list of your doctors, make sure that they accept the plan. We'll get a list of your medicines, make sure that your medicines are covered okay, and then we'll go through all of your out-of-pocket expenses that you might incur. Some of your Medicare Advantage plans, even though the monthly premium is cheaper, if you were to experience some serious health challenges, your total out-of-pocket actually might end up costing you more. Some of the annual maximum out-of-pocket on the Medicare Advantage plans can be as high as $6,000 to $7,000. So again, we'll talk about all these details when we have an opportunity to speak with you on the phone, but this chart just helps understand that Medicare Advantage plans are all slightly different. Okay, now we're going to talk a little bit more about Part D, prescription drug plans. Part D prescription drug plans are also not standardized. Part D prescription drug plans do all have a similar framework. However, they're not the same. So the framework is going to include a monthly premium. It's going to have a deductible on some medicines. Then you're going to decide what pharmacy that you're going to use. And then we will look at your list of medicines and decide what plan is the best for you, because every Part D prescription drug plan has a different formulary. The way this works is, let's say you had a very common, very inexpensive generic medicine that is going to be considered a tier 1. If you have maybe a little bit more expensive generic medicine, that's going to be a tier 2. If you have a medicine that you take that's either a brand name or it's relatively new, it's not out in generic form yet, that's going to be a tier 3 and so forth. So the higher the tier, the more expensive the medicine is. Each Part D plan may have the same medicine on a different tier. So that makes a big difference in what that medicine is going to cost you. This next page goes into a little bit more detail on the Part D prescription drug plans, how they work throughout the year in regards to the coverage gap, more commonly known as the donut hole. The first thing that happens on a Part D prescription drug plan is annual deductible. 2019 maximum annual deductible is $415. Some of the plans will have this deductible, some will not. Some plans will have a deductible, but the deductible does not apply to generic medicines. Once your deductible is met, if there is one, then you will begin paying 25% of your prescription costs during what's called the initial coverage period. Now, once you reach the $3,820 initial coverage limit, then you go into what's called the coverage gap. Once you get to the coverage gap, the percentages change, and then once you have reached $7,653, you come out of the donut hole and you go into what's called the catastrophic coverage. This can all seem rather complicated and confusing, and I agree with you. What I would like to say is I don't want you to try to really memorize all of this. We're going to actually help you make the best decision possible. We're going to get a list of your medicines. We're going to go to the Medicare website. We're going to create a profile using your list of medicines, where you live, your pharmacy choice, and so forth. And we're going to use that website to calculate, out of all of the plans available in your area, based on all of these scenarios, taking into consideration all of these figures, which one is the best overall, least expensive plan for you. Let's talk a little bit about a timeline. If you do decide that you want to get a Medicare supplement plan, you have a 6-month window before and after whenever your Part B starts. So whenever your Part B effective date is, you are allowed to submit an application to an insurance company 6 months before. Also, you are able to wait until 6 months after and still be in your open enrollment, which gives you the option not to worry about answering any health questions. One of the reasons that it's good to do this 6 months before is quite simply whatever rate that we quote you at the time that we send the application to the insurance company, that rate is going to be locked in for your first year of coverage. So if there's any rate increases from the time we submit the application until the time that your plan actually becomes effective, you lock in the lower rate. The timeline for choosing a Part D prescription drug plan or a Medicare Advantage plan is a little bit different. You have the month that you turn 65, you have 3 months before, and you have 3 months after. So during this time frame, you are able to choose and enroll in a Part D prescription drug plan or choose and enroll in a Medicare Advantage plan. Okay, the lower part of this slide is talking about how to enroll in Part B of Medicare. Now, Part B of Medicare is not free. You may need to take some action. However, if you are already receiving Social Security benefits, you will automatically be enrolled in Part B of Medicare. You will be enrolled in Part B of Medicare, you will be sent your Medicare card, and you can also choose to pay your monthly premiums for Part B of Medicare as a deduction from your Social Security. However, if you have not yet begun receiving Social Security benefits, you will need to take some action to get Part B of Medicare. You can do that online, you can do that in person, or you can call Social Security over the phone and then they can assist you in that process. I want to thank you for watching this video. I know that we covered a lot of information in a very short amount of time. I don't expect you to remember everything. I do expect you to have some questions. If you would like, you can give me a call at 800-499-1942. You can send me an email at billy@medicarehealthinsuranceoptions.com. You can go to our website and take a look there and contact us via the website. We encourage you also to make an appointment on our calendar so that we can set a time where we can call you. You can have your questions ready. We will discuss your specific needs, your specific situation. We will go through all of your options and we will give you some recommendations based on the information that we receive from you. And then you will be able to ask any questions that you have at that time. Again, thank you for watching this video. We look forward to speaking with you in the near future.